Hello everyone. This is chapter 7 of our Chris Dashman and Hull required textbook. And chapter 7 talks about the examples of implementation in generalist practice. This is a pretty comprehensive chapter that covers a lot of areas in terms of generalist practice, including child maltreatment as the main focus. But it also talks about generalist practice with older adults, crisis intervention, diverse populations, and more. So this will be just a brief review of the chapter. Even though it covers a lot, I will try to speed through it more quickly than I did other chapters, even though it's hard when there's more content involved in the chapter. So the learning objectives for this chapter is recognizing child maltreatment. So as you complete this chapter, you should be able to recognize child maltreatment. Also have more examination of child protective services, applying the generalist intervention model to practice in child protective services. And you should also know how to examine and implement crisis intervention. The chapter also provides disaster relief and trauma counseling in terms of content. It also helps you know how to work better and empower, and from an empowerment framework for older adults. It also employs generalist practice in empowering immigrant populations, and it also addresses alcohol and other substance use. The book goes over a profile, or the profile for child maltreatment. Historically, social workers have also always played a key role in child maltreatment and child protection services. In their role, social workers do assessment. They are also key in detecting child maltreatment. When we're talking about child maltreatment, there are a number of ways that children can be abused. There's physical abuse, child neglect, emotional, psychological neglect, emotional, psychological, and physical sexual abuse. But when we talk about maltreatment in general, we are talking about physical abuse, inadequate care and nourishment, deprivation of adequate medical care, insufficient encouragement to attend school consistently, exploitation by being forced to work too hard or too long, exposure to unwholesome, demoralizing circumstances, again, sexual abuse and psychological abuse and neglect. Sometimes we just focus on physical abuse. However, there is more involved, and there are different types and severities of maltreatment. We use the term maltreatment as an umbrella term to encompass all types of abuse, particularly of children. Child maltreatment is a critical issue for social workers, and it's very difficult to understand because it has so many components to it. However, as generalist practicing social workers, you need to know the clues that signify maltreatment of children. Even if you do not work directly with protective services, you need a basic understanding of child maltreatment in order to assess the possibility of occurrences in any family in which you may work. Social workers identify child maltreatment in various areas, not just specifically child welfare workers or child welfare social workers. Social workers need to be able to identify abuse in any systems that children come into contact. One main area is the schools, particularly because children spend most of their day at school and several days out of the week at school. So that is a key area where social workers can identify child maltreatment. Other areas include hospitals, in which all medical facility providers work, including social workers. but they need to be able to detect child maltreatment. Doctors, nurses, outpatient pediatric offices, and such. When you think about all the areas in which children can present, such as daycare centers, recreation centers, social workers need to always have a keen eye to address and identify any type of maltreatment that may be occurring. Oftentimes, social workers need to assess whether abuse is actually occurring and who the perpetrator is. Oftentimes, social workers have to assess the family in terms of the possibility or occurrences of child maltreatment. And oftentimes, social workers refer clients and families to services if they should indeed identify maltreatment. One important key piece to know and understand is that social workers are oftentimes, in most states, mandated reporters. And this means anytime there is suspected abuse, neglect, or child maltreatment in general, social workers need to report it. It's not necessary to confirm it. Once you file the report, it will be the role of child welfare or child protective services to investigate and to determine if maltreatment actually occurs. However, if there's enough evidence or concern for child maltreatment, social workers need to still detect and or file a report. When you're thinking about the definition of physical abuse or child maltreatment, we need to have good, firm definitions in order to identify what it is when we're detecting physical abuse, but also when we're giving those reports to Child Protective Services. The textbooks identify physical abuse as non-incidental injury inflicted on a child, usually by a caregiver, other adult, or sometimes an older child. Specific definitions for abuse vary from state to state, and they can focus on whether the alleged abuser's purpose is to intentionally harm the child. Other definitions ignore intent particularly, but emphasize the potential of actual harm done to the child. We also need to understand that there may be cultural implications where our definition in the United States or American culture may differ greatly from other cultures. And this may mean there may be a family from another culture who may be engaging in practices that are appropriate for the culture but can be considered child maltreatment under our definition. And this we need to be sensitive about. There are also sometimes cultural practices that may be acceptable within that particular culture but may constitute abuse and neglect. Even though we need to note this, as I stated earlier, social workers are mandated reporters. So as long as the abuse or child maltreatment falls within the definitions that we have, we need to report it, and minimum allow Child Protective Services to assess, do an investigation, and make the final call on whether child maltreatment has occurred. The textbook talks about physical and behavioral indicators that provide some clues to child being physically abused. And the book also identifies 6 categories overall in which to understand or know when a child is being physically abused. One area that the textbook talks about is the behavioral extremes that a child who is abused may convey to caregivers or providers of care. And we need to be aware. Now, a lot of these behavioral extremes can be attributed to other things. But what the textbook is really identifying here is to at least let it come to your radar as a generalist practicing social worker that abuse may be a key factor when one or a combination of these things occur. Developmental lags are identified. So if there's any delays in a child's normal development, hopefully you're learning about the developmental stages in your human HPSI class, your human behavior in the social environment class. But any type of developmental delays may trigger concerns of child maltreatment. The type of delays that are identified specifically in the book include language delays, poorly developed social skills for their age, or lags in motor development. And sometimes this may happen because the children are forced to direct their attention and energy toward coping with their abuse that the normal development does not occur. Poor academic performance may also be a key factor, especially when you have a pattern of a child performing normally or having decent grades, and then maybe seeing a decline, a sudden decline in their academic performance. Sometimes children who are maltreated require special education services. Sometimes they score lower on standardized tests and may exhibit what may appear to be learning disabilities, and oftentimes need to repeat grades because of child maltreatment. Sometimes this is not quickly picked up on in school settings, as sometimes they're looking at just academics performance and they may think of it as just being a learning disability or behavioral problems. However, a lot of times school systems do not consider child maltreatment as being the root cause of the academic performance. Aggressive behaviors are also a key behavioral extreme related to child maltreatment. Extremely passive, accommodating, or submissive children. And in that you will see their behaviors as being odd or out of place compared to normal child behavior, such as a child being very affectionate with strange adults. Even at first contact or first meeting that adult, they may hug, kiss, or sit on that adult's lap. Again, a stranger, and does this regularly and consistently with strange people. That may also be an example of passive, accommodating, or submissive behavior. Children who are maltreated oftentimes have difficulties in their peer interactions, and that's interactions with other children. They display psychological problems as well. And so now we're going to look at child neglect. Child neglect, defined by your textbook, is a caregiver's failure to meet a child's basic needs that may involve deprivation of physical, emotional, medical, mental health, or educational necessities. When we're thinking about the definition for emotional psychological neglect, it is the passive lack of attention to a child's need that includes inadequate nurturance, inadequate affection, refusal to provide adequate care, or knowingly allowing maladaptive behaviors such as delinquency or drug abuse. The neglect includes parents who are, or caregivers who are inconsistent, unresponsive, and or insensitive to a baby, infant, or child's cues and signals. It also can be babies learn that they cannot count on their parents for care and support, so you may see changes in their attachment, very low attachment to their parents when they're neglected. Also, emotional psychological abuse, which is more aggressive and negative than emotional neglect. When we're talking about emotional and psychological abuse, that can be verbal and emotional assaults, threatened, harmed, or close confinement. So again, it includes verbal and emotional assaults, threatened, harm, or close confinement. It also involves purposefully belittling, humiliating, rejecting, undermining a child's self-esteem, and generally not creating a positive atmosphere for a child. Emotional psychological maltreatment includes both emotional psychological neglect and emotional psychological abuse. I would like to add here that neglect, emotional psychological neglect and abuse are oftentimes not reported as often as physical and sexual abuse. Also, it sometimes is one of the more harder abuses to confirm, as it is hard to see as a physical abuse, which may be a bruise or a cut. And also, neglect and emotional abuse and neglect also mimics other things, and oftentimes can be seen as a psychological problem, when indeed it's actually a byproduct of abuse or neglect. So emotional psychological maltreatment can be classified into 6 types according to our textbook. Spurning, which is hostile, rejecting, or degrading, which includes verbal and nonverbal caregiver acts that reject and degrade a child. Terrorizing is another form of emotional psychological maltreatment, and it includes caregiver behavior that threatens or is likely to physically hurt, kill, abandon, or place the child or child's loved ones. Objects in recognizably dangerous situation. So again, threaten or is likely to physically hurt a child, kill or abandon, all those type of terrorizing tactics. Isolating a child can also be a form of emotional and physical maltreatment, and it includes caregivers' acts that consistently deny the child opportunity to meet needs for interacting or communicating with peers or adults outside or inside the home. Exploiting and corrupting, which includes caregiver acts that encourage the child to develop inappropriate behaviors. Self-destructive, antisocial, criminal, deviant, or other maladaptive behaviors. Denying emotional responsiveness. Ignoring, and that includes caregiver acts that ignore the child's attempts and needs to interact, and showing no emotion interaction with the child. And mental health, medical, and educational neglect, which includes unwarranted caregiver acts that ignore, refuse to allow, or fail to provide the necessary treatment for the mental health, medical, and educational problems or needs of the child. We know that emotional and psychological maltreatment can result in many things in children, including low self-esteem, aggressiveness, and antisocial behavior. It also can result in substance abuse, challenges with relating to other people, learning deficits and physical problems, and is also linked to inadequate health care. We also see risky behaviors such as drinking and alcohol often in children who are abused. Sexual abuse is any sexual interaction, including fondling, sexual kissing, and oral sex, as well as vaginal or anal penetration between an adult and a child. The book identifies it as prepubescent child, but in general, any child. Incest is a form of sexual abuse. Again, incest is a form of sexual abuse, but it's between people that are closely related to legally marry, which usually is interpreted to mean a father or daughter, a mother or son, or brother or sister combination. Again, incest is a form of sexual abuse. It's sexual intercourse between people too closely related to legally marry. Sexual abuse in families can involve blood relatives, oftentimes uncles, grandfathers, and step relatives as well. Sexual abuse can often happen with stepfathers and stepmothers as well. And there are symptoms that indicate sexual abuse may be occurring, such as physical problems in that child, emotional indicators, increased or inappropriate sexual behavior, and difficulties in social relationships. There are also a variety of physical problems that are indicators of sexual abuse, and the book provides example of that, including sexually transmitted disease, pain, bleeding, or bruises in the genital or anal area. Pregnancy is a huge indicator as well. Emotional indicators provide the secondary category of symptoms identified in your book, and they include such things such as depression, anxiety, low self-esteem, as well as thoughts of suicide. The third category of sexual abuse symptoms involves increased or inappropriate sexual behavior. Sexual abuse children tend to manifest behaviors such as overt sexual acting out toward adults or other children, compulsive masturbation, excessive sexual curiosity, sexual promiscuity, and an obsession with sexual play and knowledge. Difficulties in social relationships make up the fourth category of sexual abuse symptoms, and sexually abused children are more likely to have a lack of social skills, be less trusting of others. We don't know the full scope of child maltreatment, as a lot of it is underreported or not reported at all. So even though we have statistics related to child maltreatment, we will never know the full scope. However, we do have some statistics related to child maltreatment. For example, we know that in 2017 there were 4.1 million referrals involving 7.5 million children across the United States. From that number, we know approximately we also know that about 2.5 million referrals were received a response from Child Protective Services. We know that professionals submit a majority of the report. About 66% of reports alleging child abuse and neglect come specifically from professionals. And when we're talking about professionals, we're talking about people who are coming into contact with children through their jobs or areas of employment. Teachers, police officers, lawyers, and social service staffs make up a lot of the reporting. We know that the highest reporting profession is education. At about 20% of teachers are doing the reporting. We also know that law enforcement and legal people are also, or people in the legal profession are making about 18% of referrals. And we know that social service personnel are making about 12% of the overall referrals. We also know that children in their first year of life have the highest rate of victimization when it comes to child maltreatment. And we also know that their children of color are often highly represented in child protective services. We know that when we're looking at abuse and maltreatment by types, physical abuse is the highest, neglect is the highest type of maltreatment at around 75%, followed by physical abuse at 18%. We know about 1,700 children died from abuse. We also know that the national rate for child fatalities is 2 deaths per 100,000 children, and 72% of all child fatalities were younger than 3 years old. We also know that boys have a higher child fatality rate overall than girls. And we also know that the rate of African American child fatalities are about 2.5 times greater than that rate of white children. We also know that perpetrators tend to be the parents. When we talk about perpetrators, we're talking about people who are actually responsible for abuse and neglect of the child. We know that more than 4/5 of perpetrators are between the ages of 18 and 44. More than half of perpetrators are women. And we know that the largest percentage of perpetrators are people who are Caucasian at 50%, African American 20%, or Hispanic at 18%. Another key point is that one thing that we are really focusing on in child maltreatment is the overrepresentation of children of color in the system relative to their numbers in the overall population. So we know that children of color are getting reported more frequently. They are being placed in foster care as well more frequently than any other children. The book provides more characteristics of perpetrators as well. The textbook identifies that perpetrators are most likely to have serious needs for support and nurturance. Also, there's a problem characterizing abusers involves social isolation. So there's a issue of social isolation related to a lot of perpetrators, and that they have low self-confidence. And because of that, they isolate themselves. We also know communication and relationship difficulties often occur with perpetrators. There's also challenges and difficulties with parenting overall. Oftentimes voids in nurturing family environments related to that lack of parenting skills. We also know that perpetrators have poor general coping skills. And when we talk about this, we're thinking about their inability to cope with stress and oftentimes lashing out at their children to deal with that stress. The textbook identifies the inappropriate delineation of responsibilities in households or families where abuse is occurring. There's also a lack in the decision-making, problem-solving skills involved in coping. And again, there's oftentimes extreme external stress and life crisis, and oftentimes poverty, and oftentimes substance abuse as well. The textbook identifies parents who neglect their children as appearing to have characteristics similar to physically abusive parents, although poverty can also contribute to the potential of neglect. Also, perpetrators of emotional psychological maltreatment suffer similar emotional problems or deficits of those of caregivers who physically abuse or neglect children. Now, earlier in this recording, I talked about Child Protective Services, but the book provides a general definition of this. And when we're talking about Child Protective Services, we're talking about the type of services such as assessment and intervention by social workers and other situations where children are deemed at risk of maltreatment. Protective services workers usually are employed by public departments of social services or particular law enforcement agencies, as well as courts addressing problems of child maltreatment. In Child Protective Services, the worker's major aim is to explore whether or not abuse is occurring, assess both the strengths and risks involved in family situation, make plans to ensure safety and minimize future risk, and implement plans to maintain healthier family functioning. The book also talks about the philosophy related to family preservation and empowering families. One trend specifically identified in family preservation is let me go backwards. When we're talking about family preservation, we're talking about services that are very intensive. And the goal is to support the family and provide services to vulnerable families to improve their ability to function in order to prevent out-of-home placement. So again, this is intensive services offered to families that are oftentimes vulnerable, and the goal is to improve the family functioning and prevent out-of-home placement. And it is a particular philosophy in Child Protective Services. There's a set of principles related to family preservation, and a lot of the decisions made by workers incorporate the family preservation philosophy. Assessments, interventions, evaluation all fall within the same family preservation model. One important principle in the family preservation model is that it's important for children to remain with their own families, if at all possible. Another family intervention concept is that interventions are considered positive. People are considered capable of changing if they have help. Additionally, family preservation emphasizes the importance of positive intervention when crises occur, so that children need to be placed out of their own homes. So that children do not need to be placed out of their own homes. Other key areas of the philosophy of family preservation includes the idea that a successful family can take place only in concerned and supportive communities that have the resources to offer opportunity and hope to the family. Also, child maltreatment is seen as a social issue. The worker in the family preservation model is to concentrate only on working constructively with families to ensure a partnership role. Also, workers help by coordinating their interventions and efforts with those of other professionals who can also be used to help the family. Also, maltreating caregivers can improve their conduct, and support and assistance is the belief under the family preservation philosophy. Also, the workers are always looking at alternative solutions for helping families until they actually find the resources and support to stem the maltreatment and improve well-being for those families. Respect is shown for each family's strengths, potential, natural striving toward growth, and capacity for change. Each family is individualized, and its unique strengths and capacities are identified. Again, keeping maltreated children within their own families is the key, if at all possible. It is considered the best thing for children as long as they are safe. So there's a belief that risk can be minimized and that children's safety maximized if internal and external pressures can be controlled for and parents are taught coping strengths. The sixth guiding principle identified in your book is that clients should always be involved in the intervention process, the assessment as well, but definitely the intervention. The book also notes that even though the family preservation model or family preservation philosophy tries to keep children in their own family, if it is determined that it is a risk to child, or the risk is too great by keeping that child within the family, a child may need to be removed in order to keep that child safe and well cared for. You still work with the family to improve coping skills, strengths, but this is done with the children out of the home to remove the risk for safety. It oftentimes falls on the social workers to be responsible for identifying, considering, and weighing factors that affect the child's safety, permanency, and overall well-being. Another key piece is permanency planning, and when that is the process of establishing a long-term placement plan for a child, which is supposedly within a reasonable time frame in the event that placement with the family is deemed not possible. So in short, oftentimes when children are removed, they're oftentimes placed with other families, which we call kinship care, when possible. If not, then that child has to be placed with a foster family. Sometimes, depending on how long that child is in foster care, some states can move to have that child adopted by the foster family if the parents or the caregivers do not meet the service plan that's in place to improve coping, functioning on whatever the assessment uncovered as being the issues related to the family or those internal or external pressures that may have precipitated the abuse that occurred. So again, permanency planning is the long-term plan. The book states that it's supposed to be short, but most children enter in foster care, stay in foster care entirely too long. And so there's a lot of work to be done from a policy standpoint and a system standpoint on how do we improve our services in child welfare to where if a child has to be placed in foster care, they're for shorter time periods rather than the lengthy time that they are placed. Again, sometimes placing these children with family members is a great option because even though they may be in care longer through kinship, they tend to do better outcome-wise because they're still remaining with the family system. And so the book then talks about the plan change process, GIM, for child maltreatment. Again, that's engagement and what engagement looks like. The book talks about the engagement piece in that the worker should have a forthright and candid approach, making a clear statement on the agency's behalf that it has learned that the child is in potential danger, and that representing the community or the agency, the worker would like to enlist the aid of the parent in determining what is going on in the home. Again, the engagement process is a joint process where both worker and family are trying to address and or resolve the problem related to child maltreatment. The book also talks about the assessment and the assessment happening through interviewing. We talked very early on in this book about what interviews should look like and appropriate interviewing techniques in the generalist social work practice model. But assessments occur with the child in child maltreatment cases, and they also occur with the family. Understanding the family and what's going on with the family, and those interviews with the child identify those areas we talked about in terms of identifying or detecting abuse, what are the behavioral patterns the child is displaying. Again, is it poor academic performance? Is it aggression? Is it psychological evidence such as depression, anxiety, and so forth? A risk assessment is key in child maltreatment. This is the process of determining both the degree or risk for children and the need to further involve the family with social services or law enforcement. Again, the risk assessment is the process of determining both the degree of risk for children and the need to further involve the family with other social services or law enforcement. Risk assessment has two primary purposes. One is to maximize children's safety within their environment. The other is to work to change and control those forces that act to increase risk within that environment. One key role of the social worker is assessing how much at risk a child is for potential maltreatment, as well as the need for protective services. The book talks about the different type of forces that come into play and can contribute to or diminish risk in a home. And the book terms this as maltreatment forces, child forces, parent forces, family forces, and intervention forces. Maltreatment forces involves the type and severity of maltreatment that is occurring in the home. These are the areas that you're looking at in a risk assessment. What are the child forces? The child forces involves the maltreated child's personal characteristics and how they may be increasing or putting that child more at risk for maltreatment. Parent forces are the characteristics or traits of the parents in that family. Another area is in terms of the parent forces is that parents' ability to manage the child and what their skill level is in child management. Also, in terms of the parent forces, you want to also consider what that parent's upbringing was and their past experience, particularly with trauma, as this may increase the risk factors in a risk assessment. The family force identifies a few areas. What are the demographic variables characterized in that family? Are both parents involved in the family? How many children are there in the family? Is the family a blended or step family? So basically, what is the structure of the family? Other things, education level, jobs, training, employment, work experience of the family, as well as their income levels, as those may provide clues to internal or external stressors on the family. Other areas of the families you want to look at is how well the family function, interact, and communicate with each other. Also, you want to look at how the family nurtures and supports its members. Also, how does that family deal with problems and stress? And you want to identify how well that family will respond to intervention support services that may be put in place for them to help. The point is, in the textbook, when you're looking at all those forces, they help you with your risk assessment. What you want to identify is the pressures that the family may be under, and understanding that the more pressures that the family has, and the less external support the family has, the greater the risk of maltreatment for that child. The hope is that with the risk assessment, you can put appropriate intervention and services in place, and as the intervention progresses over time, the family will ultimately be strengthened. As the family gains more support and strength, the maltreatment risk to that child should also decrease. From the generalist intervention model in the planning phase, the type of goals that should be outlined is self-sufficiency for parents and families, communication skills and improving those skills, improving parenting education and knowledge, ability to manage stress or stress management, identifying impulse control or planning to help clients regulate their impulses, and problem solving skills, interactive nurturing, and resource enhancement. Any of those areas can be goal areas in the generalist intervention model. And also the book talks about the implementation and what that looks like. Some of the type of services and implementation includes home visiting support services, parent aides, visiting nurses, special school programs, daycare, emergency shelter and or foster care programs, parent education programs, sometimes job-seeking employment services, crisis intervention, crisis nurseries, respite care, which usually are support places that you can drop children off if necessary, so that the parent can engage in either education services, support, and or self-care. Sometimes adequate housing services are needed, financial assistance and or transportation services are all needed in the implementation phase. And then lastly, the evaluation, termination, and follow-up stage, where workers must document progress or lack thereof, review the goals and measure whether clients are meeting those goals and objectives. Sometimes that means that you have to amend the intervention plan to meet the current risk situation. And also want to review progress with service provision during the intervention period and how well it went. And you also want to see how much risk have been decreased. You also want to make sure the safety of the child and safety of the family have been increased, and the overall family unit, whether the overall family unit has been strengthened. In child maltreatment, cases are usually terminated when the risk has been determined to no longer be present or has been significantly decreased so that children are adequately safe. From a generalist practice approach, it focused on preparing workers for action with individual families, groups, organizations, and communities, as we stated earlier in this textbook. However, as we're working to address child maltreatment, there are some core principles concerning how we work with them. One of those core principles is empowerment. When we're thinking about empowerment, is how do we support and uplift these families to reduce risk and improve overall safety. Empowerment can also include linking abusive parents with support or child behavioral management groups. It may also be support groups for survivors, both as children and adults, and other type of services that help strengthen the family. We also know that from an organization and community standpoint, the social workers and other helping professionals are striving to find ever more effective and efficient means of improving the lives of children and their families. We also know enhanced service provisions is also being pursued by local, state, and federal public units of government. Practitioners should address child maltreatment by considering it always on a continuum that includes prevention, reporting, and treatment. The book also talks about the macro areas as well, which is emphasizing the reporting of child maltreatment and education related to reporting of child maltreatment. Also focus on providing services aimed at prevention before the abuse occurs. Also more supportive system geared toward improving resources and services for families in general. Also improving resources and support for the workers themselves. As we know, there are many child welfare workers or child protective service workers who are overburdened with cases, and they have high levels of burnout as well. More resources also need to be directed at treatment instead of case finding. And we also need to focus on treatment outcomes and improvement rather than on treatment process. And also we know that community and neighborhood support should be located and developed. So we need more services in local communities. And for those communities that do have local services, we know that it needs to be improved upon oftentimes. The book also talks about a strategy of crisis intervention. Crisis intervention is brief and time-limited therapeutic intervention where a social worker or other mental health professional helps a client system in crisis recognize those problems or the problems that lead up to a crisis. Also, identifying potential coping methods as well. So, in general, crisis intervention helps people learn to cope with or adjust to extreme external pressures. The textbook also provides another definition of crisis intervention. It's when a precipitating event occurs. A person has a perception of the event as threatening or damaging. This perception leads to emotional distress, and the emotional distress leads to impairment in functioning due to failure of an individual's usual coping methods that previously have prevented a crisis from occurring. Crisis intervention can happen on all levels, the micro, meso, and the macro level. It could be a social event in the macro environment, such as causing a disaster and or a major disruption, such as a natural disaster, earthquake, flood, or drought. I know sometimes when we think of crisis intervention, we think of it only at an individual level, but it can also be in a macro level as well. And on the individual level or the micro level, it can look like emotional distress on an individual or a family, and it can be an incident such as a death of a loved one, a loss of a job, an unwanted pregnancy. So whatever that particular family deems as a crisis for them and their functioning. We do know that when a crisis does occur, that it can present itself in many ways, and it has different impacts on families, such as financial problems, physical illness, accidents, substance abuse, sexual assault, and involvement in the legal system, again, can all be examples of crisis in families. The crisis process identified in the textbook identifies it as an individual being exposed to a heavy amount of stress over some period of time. Also, the stress acts to make the person exceptionally vulnerable to intimidation and assaults from the outside. The usual emotional protection from worrisome and painful incidents is weaker than usual, and there has been some precipitating event that served to trigger the client's crisis state, which is characterized by instability, ineffectiveness, and the inability to take action. As the crisis continues, other stressors to which he or she is being exposed, As the crisis continues, the individual perceives the precipitating factor and other stressors to which he or she is being exposed as increasingly serious threat. And lastly, the person experiences surging anxiety and such accompanying troublesome emotions as depression or grief. And then the book goes on to talk about the steps in crisis intervention. I won't go into detail here. However, the planned change process is utilized for crisis intervention as well. As stated, this chapter covered a lot of areas, but I'm just going to try to briefly close out now, trying to cover the main areas in the chapter, but please make sure you review and go over this chapter 7, in detail. But the chapter goes on to talk about how crisis intervention looks with families and groups, how crisis intervention works with organizations and communities. It also talks about disaster relief on the macro level and assessment and interventions in disaster relief. Other areas covered in the rest of this chapter is social work practice with older adults and what it looks like. Emphasizing the need to assume multiple roles to meet the diverse needs of different type of diverse groups, including older adults. Also emphasizing the empowerment orientation to practice with older adults as well as with child maltreatment. The textbook also talks about essential concepts in empowerment with older adults and strategies for working with older adults. Please take your time to review that section in detail. And that's whether you work in your field internship or even plan to work with older adults in your career. Usually you will most likely come into contact with older adults regardless. And so it's important to review that. The chapter goes on and talks about social work practice with immigrants status, providing good definitions of immigration status, as well as non-immigrant, documented alien definition versus undocumented alien. That is also important for you to know for this course, so please take time out to read that section as well in detail. And it also talks about critical issues and working with people having another national origin. All those things are important. And then the last section of the chapter talks about alcohol and other substance use. And it talks about why it's important for social workers to have generalist practicing social worker to have knowledge of alcohol and substance use. And it also goes over some important terms and concepts related to alcohol and other substance use. Please take your time to go over that section as well in detail, as well as the role of the social worker as a referral agent for this course as well. The book also does a very good job, I think, of talking about how alcoholism and substance use impacts family relationships, and your role in intervention as a social worker with dealing with alcohol and other type of substance use orders. The book also covers the a four-stage recovery model, which is important for you to know and understand for this course, and also the strengths perspective related to alcohol abuse dependence, and which again can be applied to substance use. And another key section in that chapter is also harm reduction approach, which is very important for you to learn and understand in this course, so please take the time to look at that in detail as well. Again, this chapter covered a whole lot of information in terms of giving you examples for understanding generalist practice. Try to go a little bit more in detail about the child maltreatment as it is important as the other areas. But as always, please take your time to review the chapter yourself. Make sure you understand all the key concepts. And it's also important to make sure that you're integrating the knowledge in this chapter as well as your other chapters into your assignments with this course. Thanks.